Hey guys, Dr. Grove Higgins here. This is Dr. Luca Podesta. He is a doctor of regenerative medicine. And he and I were just at a conference here at Regenix down in Florida about shockwave. But we're talking a lot about regenerative medicine. And really, the reason I wanted to talk to you, doctor, is the fact that you've been doing regenerative medicine for how long?
25 years.
25 years. So in 25 years, you've seen it go from infancy and something basically non-existent to something that is actually getting to be quite robust and well-known.
Correct.
And such. From a real basic standpoint, what's a good description of regenerative medicine?
It's, to me, regenerative medicine is really teasing your body to be able to wake up and heal itself. We can do different things with different types of treatments, with platelets, with bone marrow concentrate, lipoaspirate, that actually can boost the body's immune system and help it tease that tissue back to normalcy.
Right.
In a nutshell.
Yeah, and so from my standpoint, I'm a chiropractor. I work with people's structure. So when structure is deficient, so you tear a ligament in your elbow or in your back, there's not a lot that I can do to help restore that. I can help you with pain, but I can't help restore those structures. Your technology, your technique, your approach is what helps people rebuild structure so that way they can be
Correct.
able to heal.
Correct.
Right.
You know, at first we weren't really sure about this technology. It's evolved over the last 25 years. I was one of the first amongst a small group that started this back in the mid-early 2000s. I started about 2005. And I really it was a reaction for me. I took care of a lot of throwing athletes. I was one of the team physicians for the Los Angeles Dodgers. Saw a lot of medial elbow injuries, Tommy John ligament or ulnar collateral ligament problems in throwers. And we had no answer. There was a procedure that my mentor, Frank Jobe, developed that was surgical, but for anybody that was not a professional athlete, really that wasn't for them. So we had a lot of collegiate guys, high school kids and younger kids that as baseball became more and more popular and kids began to throw much more frequently and harder, they started to get these injuries and there was no treatment at that time. So in 2006, Alan Mishra presented a paper and published in the American Journal of Sports Medicine treating tennis elbow with cells, with platelets, platelet-rich plasma. And that kind of really triggered me into figuring out a way that maybe I could use this as an approach to these ligament injuries. And we started a study, eventually published in 2013, had excellent results, and we were able to get throwers back within 15 weeks at the same level of throwing or better without operating on one. Right. And we followed that up in 2013, looking at our long-term effects of the original 34 that went through this program. And they continued to do well, and none of them had recurrences of injuries or recurrence of medial elbow pain. Yeah. You know, so what we learned over this time was really how to get this data that we learned and the techniques that we learned from treating ligaments and apply it to tendons, joints, arthritis, muscles, things like that. And that's where we've gone now.
Yeah, no, and some of those surgical cases probably never fully returned to their sport, did they?
Right. There's always a group that fails.
Right. So now the idea of things like PRP, so platelet-enriched plasma, you've got stem cell therapies and bone marrow concentrate and stem cell coming from fat and such like that. Those things that's really grown, and it's becoming kind of an industry of its own. The problem with that is now you have a lot of practitioners that are popping up that really don't know where they're going. Patients are looking for solutions, and so they're seeing these things, and it's popping up in ads and such like that. What are some really basic questions that a patient can ask a potential doctor that will help them know that this is legitimate, that they're getting,
sure,
that the physician is practiced and trained properly in order to be confident that they are going to spend a bunch of money, they're going to get the result that they're trying to get?
It's a great question, because I mean, I tell people this all the time. I said, you know, people come in, they're like, well, I saw this guy, and they want to do a PRP. First thing I ask him is like, what's his experience in doing this? You know, how long has he done it? what kind of PRP is he going to use? All PRP is not created equally. There's differences. Do they count the cells? Do they know how to dose PRP? Because that's where the literature is leading to now. Is it's like a drug. It has to have the right cell content and number of platelet cells to be able to get an effect out of it. And different tissue responds with different cell counts. But the big thing is really looking at who's legitimate and who's not. I mean, there's a couple of different ways. You could look at Google for reviews. Look at really if he sounds like a used car salesman, he probably is.
Right.
It's like when I see a patient, it's like I'll sit there for an hour with people explaining them the pros and cons, how I use this, how I apply it, why I do it for certain things, what combination of treatments I will do, like a platelet-derived treatment or platelet and bone marrow, which has the progenitor cells or stem cells or fibrin matrix or hyaluronic acid. What I've found in my research, and we do conduct a lot of research and publish a lot on the topics, is, combined therapies may work better than just one therapy alone. So we're adding these different things in to try to throw as much at this tissue as we can based in science that will give us the effect and the healing that we're looking for.
Yeah. So basically, what you said there is ask about their experience, where they
Correct.
learn it, and what's their experience. How many of these procedures do they do? What's the technique that they're using?
Right.
How do they get the platelets? How do they get the cells? And basically, what's the concentration?
Right.
What are they putting back in?
Right, exactly. Do they know what the baseline was, like what your platelet count was before you did it? Do they know how much you concentrated this down? And the other thing is, which is probably even just as important, is do they track their outcomes? So, just by saying, yeah, I know it works, they don't know that, because if the patient never comes back, they don't know if it worked or not.
Right.
We're pretty diligent in tracking people over at least a year out to see. And we have different programs. I mean, I schedule people back in the office frequently, and we use these subjective outcome studies that we will tabulate in the office when they come in or over the phone, but we know any point in time down that treatment healing process where they are, or where they're standing from a healing process.
So, last question. The procedure is important, but what you do afterwards is equally as important, and maybe even more so than just the technique that's being employed. You guys are parking the materials where they need to be, calling the body's attention to where the healing needs to occur, but then those cells need direction.
Correct. What I found, especially with our early ligament work, was if we were too aggressive with the rehab, they failed. And what we found was, I mean, this is not like crazy glue. You put it in and it's all of a sudden it glues everything together and it's working. It's a living cell, so the cell has to grow. And we found it takes at least 3 weeks for the collagen fibers to proliferate. Cross-linking of the fibers for strength has to occur. And that usually takes about 3 weeks. So if we're too aggressive in that period, there's a good chance it's not going to work. So we allow the patients to go through an early protected range of motion program. Some tissues will protect with a brace or a boot or a sling, things like that. I'll allow them to do different things to maintain mobility in a safe range of motion. But the rehab is just as important as what you put in, and different adjuncts that we can use, heat, shockwave therapy, laser therapy, chiropractic therapy. I mean, anything that we can protect them and then advance them through this process. And it's a long process. And we've done it so long, we know what tissues respond in what periods of time. That helps, and I mean, I've never been a protocol guy from a rehabilitation standpoint. It has to be goal-oriented. I'd rather call these exercise progressions. And I mean, I will talk to my therapists, whoever's going to rehab these people, one-on-one, especially if I don't know them. If it's someone that I know and I work with all the time, that's fine. I'll send them, this is what we did, this is what I need done. But if someone's new, I get on the phone before that patient ever sees them to discuss the rehab, because I don't want them doing things that are going to disrupt the cell structure, like Graston or deep tissue massage, because that can damage these early onset of this cell growth. So we protect them.
So that's, and that's the reason that, I mean, one, we identify the patients that
Right.
we send out to docs like
Yep.
you, and there's really only a couple of docs that I send people out to in Colorado. But then we know how to rehab them. We know the techniques. We've talked
Right.
to the docs, and so then we know, and we're very confident that we're taking the product that you provide us, and we're able to mature it and take it to where the patient really wants to be, which is pain-free with higher quality of life because they're able to move well and with confidence that it's going to last.
Yep.
Yeah.
Absolutely.
Yeah.
Absolutely.
So, hey, this has been fantastic. Dr. Grove-Higgins, Dr.
Luca
Podesta.
Podesta. Thank you.
And regenerative medicine works. Just, you got to know what you're getting into, and knowing the right guys helps and get you the results that you're going to be paying for. Cool.
Thank you.
Yeah.